Dina Diorio, Mecklenburg County Manager, and I am joined today by Gibby Harris, our Public Health Director. Our American Sign Language interpreter for today is Meg Tucker, and as always, today's virtual press conference is closed captioned for the hearing impaired. Just a few things I want to go over before I turn the podium over to Gibby. Gibby will give you an update regarding testing and our public health effort to control the outbreak we're experiencing, as well as efforts that we are undertaking to expand testing in our community. And as we've all seen in the last few weeks, we are seeing an increase in cases. We are seeing an increase in the demand for testing. We are well aware of that, and we are taking steps to try to rectify that. In addition to that, I'm pleased to announce that earlier this week, the Board of County Commissioners adopted a resolution to establish a COVID-19 Recovery and Renewal Task Force. The task force is going to look at how we come out of COVID-19 to make our communities safer and more resilient. They will be looking at things around health disparities, mental health, behavioral health, housing, homelessness, food security, human services, child care, workforce development, and arts and culture. And so this task force is really going to be focused on things that are not necessarily related to economic recovery, although that will be a small part of it, but really around the areas where the county has the ability to make a difference and to be able to add value and add resources to those areas. The task force will be comprised of 23 members, and from those 23 members, the board will select a chair and a co-chair. We are currently taking applications for the task force. If anybody's interested, they can go to our website and fill out an advisory board application, as well as attach a resume for the board to consider. The board will consider the first cut of applications on June 23rd, and if they're unable to fill the slots from the applications we've received by June 23rd, they'll make their final appointments on July 7th. And so we hope that a lot of people will be interested in participating. We anticipate that the task force's work will take about 1 year, so just want to make sure people are aware of that. In addition to that, yesterday the Business Leaders Roundtable met, and we are focused on a marketing campaign. We have a subcommittee that's comprised of Center City Partners as well as Ray Ward, along with other marketing companies in Mecklenburg County, to really start to focus on targeted messaging around how to keep yourself safe, including wearing a face covering, wash your hands, practice social distancing, and other things that will keep our community safe. There will also be a focus on our Latino population. That continues to be the population where we are seeing the most increase in cases. There's a lot of community engagement involved in this messaging campaign. There's going to be a survey of the Latino community to get some more input before the messaging is completed. And it will be pushed out on all of the media platforms, paid media, as well as free media, so that we can get that out to those populations in the most effective way that we can. We were awarded $200,000 from the COVID-19 Relief Fund to pay for that effort. So we're very excited about the work that's being done there and looking to make sure that we get this messaging out as quickly as we can. In addition to that, Mecklenburg County government is starting to work on its reopening plan. We have 3 stages that we're focused on right now, and stage 1 will happen sometime in mid-July. And so we continue to provide all of our services virtually, but we do know that it's time to start bringing our employees back in some kind of staggered, staged phase. So we will continue to keep the community updated on how that will happen and what the capacity will be. We will not be opening all of our facilities to full capacity right away. Like I said, there will be several stages, but we want the community to be aware that Mecklenburg County is beginning to think about reopening for business in person. To that end, Park and Recreation will begin allowing reservations for their baseball fields in July. You must still comply with mass gathering restrictions, but you will be able to reserve them for baseball or softball practice only. And per the governor's order, you will still not be able to participate or reserve fields for contact sports like soccer, lacrosse, or football at this particular time. But again, those things will evolve as we move forward. And finally, before I turn it over to Gibby, I just want to let everybody know that the county did receive the official letter this morning from the RNC host committee, or the RNC committee last night, saying that they will move the vast majority of its convention to Jacksonville, Florida. At this point in time, we are now evaluating what role the county will have in preparing for this scaled-down event. And as we move through that, we will certainly keep you posted on that. And at this time, I'll turn it over to Gibby for her update. Thank you.
Good afternoon. As usual, I'll start with a data update. As of noon today, we've had 6,275 laboratory confirmed cases in Mecklenburg County to date. That we have had 11 days of triple-digit numbers, so over 100 new cases every day for that 11-day period, the highest being 250. We've had 123 deaths and 19 outbreak situations in congregate living facilities at this point in time. From our data report, 72% of our cases still are coming from individuals between the ages of 20 and 59 years of age, and that gives us a focus for some of the messaging that we need to do in our community. And as mentioned earlier, a third of our cases to date have been among the Hispanic community, and a large number of those are in the 20 to 35 age range. 92% of our deaths, however, have been in individuals over the age of 60. We have had 9 deaths in individuals between the ages of 40 and 59. Only 2 of those did not have some type of pre-existing health condition. Our trends continue to move in the same direction. 10% of our positivity, we have had a 10% positivity rate over the last 14 days. We've had an average of 101 individuals in the hospital every day over the past week. Both of those are an increase over the past 14 days in those trends. We continue to see a decrease in social distancing, and before long, we will be back at where we were with social distancing when we put the stay-at-home order in place. In terms of testing, we have significantly ramped up testing in Mecklenburg County. We met our 5% goal that was given to us over 30 days, 5% of the population over 30 days. We did meet that goal. We're testing about 2,000 people a day in Mecklenburg County. Those tests are done at our healthcare system testing sites. Please do not go to the hospital to be tested. You need to contact the hospitals through their websites or show up at one of the roving sites for testing, but please do not go to the hospital for testing. We have 9 CVS pharmacies, and I believe 5 more open today. You can go to the CVS pharmacy site for that testing, as well as some MD offices and urgent cares in the community are making testing available. We're continuing to work with the state to expand testing. We received specific guidance from the state this week. Earlier this week, a number was put out. The state continues to want Mecklenburg, as well as a number of other counties, to increase their testing availability. The numbers have not been finalized in terms of how much testing they would like us to do. The original numbers that were put out there were guesstimates. So we're continuing to work with the state on that. One of the things that's been clear in our conversations this week is that for Mecklenburg to continue to increase testing at a high rate, it's going to require additional resources, and we're having that conversation with the state as well. The other guidance that came out was on Tuesday, where the state asked that we add testing for those who have been involved in mass gatherings to the testing requirements. At this point in time, both healthcare systems have added asymptomatic individuals who have attended a mass care setting as one of their criteria for testing. With our CVS pharmacies, if you go to their site and put in that you're asymptomatic, there is also a space for you to put where you are in a high-risk category as defined by the local or state health department. You need to check that, and they should be able to give you a test as well. So we are continuing to look at ways to make sure that those who have been involved in mass gatherings, whether that's church or the protests or any other type of mass gathering have the opportunity to be tested. Some of the limitations, though, are in our capacity in the county, as I mentioned earlier. So I know some people are recognizing, especially if they go into the drive-through sites that aren't requiring appointments, that at some point during the day they're turning people away because we've had so many people showing up. You're likely better off, if you can, to schedule an appointment. I do know that some of our appointment sites are not always full. I wanted to speak briefly about curves and the modeling that we've been doing in the county. We've had lots of questions about that recently. We continue to monitor several models to help us estimate what our healthcare needs may be in the future. We're working with both of our hospital systems as well as continuing with the CHIME model. Those are being fairly consistent, and if you saw the models that came out of the University of Washington this week, the models we're looking at are fairly consistent with those models as well. As of now, none of these models indicate that we are headed toward overwhelming our healthcare system. However, these models, as we've mentioned before, continue to be quite volatile. The ground continues to shift under this particular virus. Recently, we've moved into phase 2. Physical distancing and mask wearing is not what we need it to be. And we have a number of large gatherings occurring. When you put those into the equation, the models shift significantly one way or the other. So we continue to watch that on a regular basis. All of these factors create a great deal of statistical uncertainty, and all of the models that we're seeing these days have a really wide confidence interval. That means we are still not confident completely in the data that this is providing to us. The one point I do want to make is that I don't believe we're moving into a second wave. We almost stopped our first wave with our social distancing, with our stay-at-home order. We are in the process of resuming that wave, and that wave fluctuates from time to time based on what's going on in our community. So we need to continue to keep that wave slowly increasing. What I want to make sure that people understand is that we have many people in our community who are still very susceptible to this infection. We do not have a cure. We do not have a vaccine. And so it will continue to spread. And as we continue to open things up, our numbers will continue to go up. What we need to do is make sure that we do not have any rapid acceleration that is going to make it difficult for our healthcare systems to take care of the individuals that they need to take care of. So the bottom line is COVID-19 is still here. Yes, we've opened some things up. People have more flexibility in their lives now, which is a good thing, but we can't be fatigued by the fact that we're not over, we're not done. We still have a pandemic on our hands. And the projections that we're seeing right now are showing some pretty significant increases, likely in mid to late August and into September. So we need you to continue to wear your mask in public and to make sure that you're social distancing as often and as much as you can, and to make sure you're washing your hands. In addition, if it's appropriate, we need you to get tested. We understand the limitations at this point in time, and we're continuing to work on trying to improve the availability. The other thing we need you to do is respond to public health if we call you. That means that you may have been exposed or that your test came back positive. We know that there are a lot of scams going on in our community right now, and people are concerned about taking telephone calls when they're not sure who's calling them. We will never ask you to pay for anything. We will never offer to sell you anything. We may ask you to verify your information over the telephone, and we will never ask you for personal information such as Social Security numbers or any financial information. If you have a call from us and you're concerned about whether it is real, whether it's actually coming from the health department, you can take the name of the staff person who's calling, and you can call our contact tracing hotline at 980-314-6999. 9410, and they will verify for you whether you have been contacted by us or not. You can also go to our website that will help you determine that as well. We need your help in all of these things if we are to keep from looking at any type of significant acceleration or spike in our curve. We know it's going to continue to go up as more people are infected, as we're out moving about, but we need to manage this, and we need your help in doing that. We'll take questions at this point.
Gibby, it's Joe Bruno. In 2 weeks, would you rather see the state move into phase 3 or move back to phase 1?
The way the numbers look right now, I would be surprised if we move fully into phase 3. There may be some additional restrictions lifted, but I really don't have a feel for that yet. The state hasn't given us any specific information on that. I do know that Dr. Cohen is concerned about the numbers and that we're all watching that very carefully. We would all prefer not to go backwards. We'd like to move forward. But again, as I mentioned, it's very important for the community to help us with that by doing the things that are going to keep us from spiking.
Hey, Gibby, it's Hunter with WCNC Charlotte. Is moving back on restrictions a possibility at all?
I'm not going to rule anything out at this point. We don't know what's going to happen over the next couple of months. We've got the models, we've got the projections. As I mentioned, the confidence intervals for those are very wide, and a lot depends on how we're responding in our community. So I think we cannot rule anything out at this point, but we're hoping to continue to move forward. I would love to see us be able to get our kids back into school this fall. But again, a lot of that's going to depend on us as a community and how we manage this.
Hey, this is Brett Baldeck from Fox 46 Charlotte. Just curious, how concerned are you about South Carolina reopening so quickly and us being a border county? We know for a fact there are people going down there to use the gym and restaurants and things like that. Also, second question, do you wish North and South Carolina worked more closely together and opened more on a similar timeline?
Well, I'll answer the first question first. Obviously, and we've had the same conversation around how we work with the counties surrounding us. It's always easier for our community and for our citizens if we're all on the same page. And we are as close to some of the counties in South Carolina as we are to counties in North Carolina. So having a similar timeline and similar restrictions would be easier for people to interpret what they can and can't do. So yes, that would be great if we could make that happen. The first question is whether I have concerns about their opening up. Obviously, we've had concerns all along about opening too quickly, whether that's in South Carolina or in North Carolina. And the fact that they are opening things more widely, and we've got people who work here that live there, and we have people that go back and forth. So we'll just have to continue to watch that and hope that it does not have a significant impact on our county.
Gibby, it's Allison Kuznets from the Charlotte Observer. Could you clarify the modeling a little more and the dates you had just mentioned, mid to late August? Would that be considered the next peak? And can you clarify, you said September. What exactly do those dates signify for Mecklenburg and the hospital's capacity?
Well, at this point, as I said, the models that we've been looking at locally do not imply that we are going to have an increase that is going to completely cause us to have to worry about our hospital systems. So that's the current data that we have and the modeling that we have. Again, modeling 2 to 3 months out is challenging to do, and it just means that those intervals are so wide that almost anything can happen in them. But based on the data that we're looking at right now, we believe that our hospital systems are going to be able to handle any surge that we might see in those dates. The same with the University of Washington model. It showed some significant increases in mid to late August and into September, and our models are showing the same thing.
Hey there, Paige Hopkins from Charlotte Agenda. I know you said you don't expect the state to move on to the next phase at the end of the month with the way the numbers are now. How much would the numbers need to change for you to feel comfortable, specifically here in Mecklenburg County, for us to enter a new phase?
Well, these are the trends that we're all looking at, the ones that I spoke about earlier, and what we anticipate and had hoped for was to see those trending in a downward direction. We're not seeing that right now with anything, except for social distancing. Everything else is still sloping upwards. So I think it's going to be challenging for us to do a lot of reopening until we start seeing at least some leveling off, if not some decrease in those trends.
This question is for Dina. Dina, do you have any intention of freeing the basketball hoops in the parks anytime soon?
I'm sorry, I didn't hear the question. Can you repeat it, please?
Yeah, do you have any intention of freeing the basketball hoops to allow pickup games to resume in parks?
Basketball is not on the list right now because of the the close proximity players get to each other when they play basketball. So right now, it is really just for baseball and softball practice only, but hopefully we'll be able to move forward with additional loosening of those restrictions over time.
Well, why is it okay for the Hornets to resume workouts, but people can't play pickup games in the park?
Because they're monitoring their players very closely when they come into the facility, which we can't do. Yep, go ahead.
Hey, this is Nate Morabito, WCNC Charlotte. Got a question for Gibby Harris, please. We've reviewed anonymous cell phone location data for the county, and the data show we recently reached our highest level of activity since March 13. What does that tell you, and how concerned are you about the decrease in social distancing?
Well, obviously, we believe that is one of the things that's having an impact on the fact that our numbers are continuing to go up. As I mentioned earlier, we know that we still have a large part of our population that are susceptible to this infection. And as long as we don't have a cure and don't have a vaccine, we know that people are going to be exposed and that they're going to become infected. The things that we know work are social distancing and masking and staying at home when possible. And as we see less of that, and washing your hands, thank you, Dina. And as we see more people out and about not wearing masks, not social distancing, it is of concern because that means the potential spread is more rapid. And what we're trying to do is prevent an acceleration of the number of cases in the county at any high rate. So we would prefer people to do what we're asking them to do. Yes, that's the simple answer.
Dana, this is Brett Jensen with WBT. I'm just curious, why wait till July 1st to allow practices to be scheduled, considering the state allowed that to happen 3 weeks ago? And I've had many parents, like an insane amount of parents, reach out to me saying that you wouldn't let them schedule practices or games. So why wait a full 5 weeks, even though the state said 3 weeks ago they could do that?
Because we're trying to get our staffing in place to be able to monitor those facilities. We have several park ranger vacancies right now, so we don't have the staffing in place to be able to appropriately monitor those facilities, but we're working on that.
Hey, Gibby, if social distancing and mask wearing is so important to getting a grasp on the increase in cases here in the county, why not mandate masks specifically or enforce social distancing in some capacity?
The big issue, there are several issues. Number one, the masking piece is a little challenging for some individuals, whether it's availability of masks or whether it's healthcare issues or behavioral health issues that make it difficult for them to wear them. But for both social distancing as well as masking, enforcement is a real challenge. We've been in conversation with CMPD and our other law enforcement entities in the county, and there's really no way to enforce those things. So we are working hard to depend on our community to do the right thing, which is to monitor yourself and to enforce it yourself for yourself, because what you're doing when you wear a mask is you're protecting other people. And that's important right now. And you also want other people to wear a mask so that they are protecting you. So we're asking that of our community, that we do the right thing without having to have it enforced upon us.
Hi, Gibby. This is Hannah Smith with The Observer. You said that we're quickly approaching pre-stay-at-home order levels of social distancing. Can you quantify that? How close are we to getting back to that level?
Well, we've seen a steady decrease from the time we moved into phase 1 in the amount of social distancing in the county. We're probably a couple of weeks from baseline if we continue at the rate we are right now with the decrease.
It's Allison Kuznets from the Charlotte Observer. Could you clarify? You said the 20,000 daily tests from earlier this week was a guesstimate. How much lower is the county talking about decreasing? Are we talking a decrease to 10,000? Where do you go from 2,000? What does the increase look like?
I wish I had an answer for you, and hopefully we will fairly soon. Like I mentioned, we've had numerous conversations with the state this week about that, because we're not the only county they're working with. They're working with a handful of other counties in the state. And that estimate has been anywhere from doubling what we're currently doing up to close to 20,000. So it's a very wide range. Right now, we're just focused on thinking about what it's going to take to do any increase at all in availability in the county. And we'll go from there. But again, continuing to have those conversations with the state.
It's Tony Messia with the Charlotte Ledger. I don't know if you have anybody from CMPD there, but as far as enforcement of these latest restrictions from phase 2, how would you characterize, I don't know if you have any citations that have been written, say, to restaurants or any of the other businesses that are newly opened. Can you talk a little bit about that? And then my other question is, you don't actually have any data on social distancing, right? What you have is mobility data about how much people are getting out of the house. You don't actually know whether people are staying 6 feet apart in the grocery store, right?
The second question I'll go to first. You're exactly right. It's mobility data that we're using across the country as a proxy for social distancing, and that is basically all we have available to us to measure that. In terms of citations, I don't know of any citations that have been issued. Deputy Chief Estes is not here this afternoon, but I do know that these folks have been pretty tied up with other things over the last week or so, and have had limited capacity to enforce some of the restrictions.
This is Katie Peralta from the Charlotte Agenda. I had a question for Dina about the marketing campaign. I was just wondering, what can we expect exactly to see from this marketing campaign as it relates to communication to the wider community, particularly those in the Latino communities here in Charlotte? And second of all, I know that other, countries like Vietnam have done stuff as simple as like mass text messages to residents to urge them to wear masks and things like that. Is this marketing campaign going to be that simple, or could it be that simple, or is it going to be something more involved?
Well, I don't think anything's off the table at this point. I think the messaging that we're trying to get out is what Gibby talked about before, is the importance of social distancing, covering your face, washing your hands, and helping to protect other people. But those messages are different for different communities. So it's what is the most effective way to communicate that to a 25-year-old Hispanic man versus a 60-year-old African-American man. So that's the stuff that we're trying to think of now, is how do we do culturally competent messaging that will resonate with these communities so they understand the importance of that. And that's what this group is really trying to really wrap up now and really try to pull together. And we'll see what mediums we can use to push that out. I don't know that we have cell phone information for people to be able to do that kind of text messaging, but if it is available and we can use it and it makes sense to do that, we'll certainly consider it.
In relation to protesters being tested, is the county considering a mobile testing site in Uptown during these protests so that they have access?
We don't have access to a mobile testing facility. What we have done is we delivered about 400 masks to the area in Uptown where the protesters gather and get information and then distribute, and we'll continue to provide those to the extent that we can. We don't, like I said, we don't have the ability to do testing right there in Uptown, but we're trying to, again, get more testing capacity available throughout the county for people to be able to take advantage of it. We can take one more.
Courtney Davis with Spectrum News. I know that you said that the data has not indicated that we're close to a second wave, but what would indicate that we're getting to that point? And when it comes to the phone calls from the health department as well, some of that contact tracing, have you all thought of sending out text messages that people might respond to that as well?
So, we'd have to get out of the first wave before we could get into the second. So I think we will continue to watch that. The assumption is that the first wave would taper off before we moved into a second wave. We're not seeing any tapering off at this point. So I could not hazard a guess as to when we would think a second wave would kick in. And in terms of the text messaging, yes, we have just implemented a new technology platform that is allowing us to send emails and text messages to the positive individuals that we are receiving test results on. And then when they provide us with the names of individuals that they've been in contact with, we can send those out that way as well. So we have a system of telephone calls, text messages, and emails that we're using to contact the people that we need to be talking with. And I think we appreciate it. Thanks, guys.